doula. Oh, there you go, finally. And it's an IBCLC to further support the postpartum mamas and babies she cares for. Got Ileana here in the room. On Zoom, we have Sarah Lowe. Sarah is an oncology nurse navigator with 14 years of experience in inpatient hematology oncology, inpatient hospice, and nursing education. She has published articles on a wide variety of topics, including interdisciplinary collaboration, nursing quality indicators, and geriatric issues. She's a proud two-time Bruin with an undergraduate degree in English literature and a Master's of Science in Nursing from the UCLA School of Nursing. Go, Sarah. And last but certainly not least, we have Victoria Yee on Zoom. Victoria graduated from the UCLA MEChem program in 2023. She works in a mixed CV-ICU, CCU at Stanford Health and started there as a new graduate nurse. Now she's also a mentor for the Stanford Nurse Residency Program. Wonderful. So we have a room full of superstars. We're going to go ahead and get started. I know that students in the call, they really want to hear about hiring processes, how you landed your first job as a new grad. So we'll kind of dive into the meat and potatoes of the conversation with the student question. What is the culture like in your unit? And what you expected while going into the job? I guess work culture in your unit. Who would like to tackle that one first?
I'm working as a nurse practitioner right now, so my role is a little different as far as work culture on my end. I do think it is different on the provider end as far as autonomy and how the attendings deal with our patients and how our workflow is. So on my service at liver transplant at UCLA, they allow the nurse practitioners to work very autonomously. We work very independently. We see our patients on our own and just round with the attendings once a day in the afternoon at some point. They don't always physically go and see all of our patients unless they're like have a transplant offer coming up and they want to go and assess them, or if they are the surgeon for the patient that they already did transplant a patient. So in that sense, I appreciate our work environment, that they respect us and our decision making. I do think as a nurse practitioner, there are some places that I've precepted when I was a student, when I did my preceptorship, there are some areas that there's more handholding. The NPs are not as able to make independent decisions, and there's more of an expectation by the patients to always see a doctor. Say certain clinics that I was at, NPs will see a patient and then the physician comes in later. But it is a fast-paced work environment. So my work environment can be very stressful because of the nature of the job, since it's inpatient. But at least I appreciate like the more positive work environment, as far as I never feel like I'm going to get yelled at for my decision making. If someone disagrees with like, oh, don't turn off that antibiotic, they'll just say like, put it back on. I've spoken to other NPs in other departments that I know their attendings may be more difficult to deal with, and you might get yelled at if they didn't like your decision, but at least I think it's important to feel like you're respected.
Wonderful, thank you. Anyone else in question? What is the culture like in your unit? Who would like to take that one?
I can also I just piggyback off what you said, because I'm also a nurse practitioner. And I think going from, I was a bedside nurse for like 7 years. So going from that to being a provider, there's that shift of now you're kind of calling the shots and you're making the decisions. And I think it's very important to have an attending, because it's collab. You always have to collaborate with an attending. So your supervising physician should be someone that you feel very comfortable talking to, whether it's to talk about a patient, or even if something at work is not going well, and you feel comfortable approaching them and kind of make changes so that it will make your work better in a way. So I think, that open communication and feeling, you know, comfortable talking to or attending is very important. And I think at UCSF, we, as a, I work in orthopedics, we have full autonomy there. I have my own panel of patients that I see in clinic. So I'm not inpatient, I'm outpatient only. So I see a lot of the pre-op and post-op patients on my own. And our surgeons are usually in clinic once a week, and they're operating. So when they are in clinic and they need help, I do help them in clinic. But most of the time, I have my own patients and I manage them. And if they need surgery, I send them to my surgeons for surgery consult. But for those patients that are not candidate for surgery or they're just not ready, I keep them in my own clinic and I manage them. And I feel like yeah, it's a good working environment for me.
Thank you, Erica.
Mhm.
How about Victoria on Zoom?
Hi. Yeah, so I currently work as a bedside RN in going back the mixed CCU/CVICU, so it's coronary care unit and cardiovascular ICU. So for me, our culture is that we really push for the teams to have bedside roundings, which I really appreciate because then when the attending and the APPs, advanced practice providers, and the other parts of whoever else might be in the rounds are there, I really get to see more of like what the patient is going through in depth. Like, and a lot of them, they do look to the nurse for our assessments. Some attendings are a little bit different, whether they want your assessment, your like head to toe briefly or not, especially in the ICU. Some they just really want, they'll wait for you to bring up any concerns that you have or anything that you think is important. So I appreciate all that either way. And also that we have like these things called Volt phones. So basically like iPhones that I think maybe UCLA might have too. But I feel like they're really helpful because I get to be in contact with my resident slash APP, whoever is the primary for that time. And then if I need to, there's numbers to escalate if I need to, and other aspects of the other teams like the pharmacy or case manager or etc. And also, I guess otherwise for culture, very glad that it was a little different in a way than I expect because I feel like there's even more support than I would have thought going in terms of like my coworkers who if I need any help, I feel like I'm very comfortable asking anybody in my unit to be honest, and whether that is just like my neighbor or my charge nurse or even like my managers for just other questions that might be more appropriate for them. But I feel like I'm grateful to be where I'm working at right now in my unit because I feel like my opinions are I guess like respected. They are thought about. Like my managers check in with us too every so often as they walk around to see how we're doing. So I like my culture where I am.
Thank you, Victoria. How about Sarah?
I did want to say that I walked into a culture that was a little bit more challenging as a new grad. There was, I think I was a hematology oncology unit. There's a lot of suffering. And I think, also an environment of where there was an expectation for high excellence, which I really appreciated. But there was a lot of stress. And I saw how we had some nurses who were very looking to be angry at something all the time. And often it became this pitting against like leadership versus staff. I just want to say that wasn't all there was to my unit. My unit also we had each other's back. There was a lot of such wonderful things about my unit and the culture. But I just want to say that I know that is something that many people are going to encounter when you go onto the floor. Like it's a very hard job and we tend to take it out on each other. And I just want to say, like, even though there are just a few people who are just very defensive or very like complaining all the time, it can make a huge impact on the culture, but so can having a few people or like a cohort of people who are very determined not to participate in that and are determined to be helping each other and looking for ways to be like uplifting the group. So I just wanted to just encourage everyone to think about how you can be on alert for that kind of like outlet. I think it's a natural human instinct to kind of take out the stress on each other sometimes. So just being aware and thinking about how you can be uplifting everyone together can make a huge difference.
Thank you, Sarah. How about Ileana here in the room?
Yeah, so what I do in nursing is very different. I knew since nursing school that I did not see myself working in a hospital. So I'm a public health RN. I work for a home visiting program called Welcome Baby. Pregnant moms sign up either while they're pregnant or while they're delivering to have home visits. So they have a nurse visit within the first week coming home. So that's pretty much what I do. And I schedule my own visits, have my own, schedule. And if I call it a unit, it would be the other nurses that are on our team. And it really feels like we're out there, or at least our Welcome Baby team. There's about 13 other hospitals that have it. I work in connection with the California hospital. And our supervisors really trust that we're out there, we're being responsible, we're doing what we're supposed to be doing. So we really rely on each other and it's very supportive. If we're in the moment, we could, reach out to each other and just kind of bounce things off each other. The latest, I think, collaboration we were able to do is I was at a home with a newborn that had just been discharged from the NICU and very obvious retractions in this little baby that had a very hard time breathing. And luckily, 90% of my moms and babies are healthy. I don't see stuff like this. I was like, wait a minute, something is not right. So, my fellow nurse was able to jump on with me and she has NICU experience. And I was like, this baby needs to go to the ER, right? And we're like, yes, now. And we were able to, make sure that baby got the care he needed. So within each other, I think when we talk about culture, it's really the nurses supporting each other. And then we go back with our team. And as a team, we also talk about because then our moms that saw the nurse get a parent coach that follows them for the next 9 months. So we continue to communicate on how our mom and babies are doing. I love it. I really love, I'm glad I'm in this type of nursing.
Great. Thank you. For our next question, what career advice do you have? And then specifically, what tips for standing out as an applicant as a new grad? Any tips and advice for landing that first job after graduation? I'll give you a few minutes if you want to think about that. Who would like to take that one?
I just
Go,
wanted
Sarah.
to say that I think one of the best advice that I was given is to think of your any clinical rotation as a job interview. You should be coming in prepared. You should be coming in on time. You should be working with integrity. You want to show that who you are and that you would be a good candidate, because a lot of a lot of new grads who get hired do tend to get hired in the institutions where they did their clinical rotations. So that's to keep that in mind.
Thank you, Sarah. Go ahead, Victoria.
For me, as I've just applied maybe a couple years back, I feel like tips for applying, I agree with what Sarah said too. Like when you go to your rotations, make sure you present yourself pretty well there too, because you don't want to come off as someone that's late or anything like that. And also you want to, in general, when you're interviewing and applying, you want to make sure that you are someone that is open to your feedback, constructive criticism, adaptable, that you know when to ask for help and ask for more support if you need to. And also like just showing your personality, especially during interview process. I think they most likely would like someone that they know that they can work with, that's easy to work with, whether that's and also making sure that you're also advocate for your patients also. And other tips I did look into if I knew who was going to be there at the interview. I kind of just looked into them a little bit if it had a name. Or also during my leadership class, during the Meccan program, we made a portfolio. I just went ahead and made a portfolio just to give during the interview. I don't know if it was really, I don't know if it was really a plus, to be honest, but I just did it anyways, especially and as I was talking to my mentors that I've had, it was just better to have it than not in case. And what else? I wanted to add something else too. I also opt for an in-person interview if they gave it versus Zoom. They had an option. I just felt like if it was in person, I can show off my more of my personality versus Zoom.
Thank you, Victoria. That's great advice. How about Erica?
Yeah, I think advice, I think, yeah, all of those advice I definitely agree. But I think one thing is that, during interview, we're looking for, specific like attributes that really make you stand out. So, I would emphasize on like, being a team player is a plus, right? You're able to collaborate with different specialties like physicians, other nurses, pharmacists, even our practice assistants, office managers. Those are, it's very important that you can work in an environment and collaborate with everybody on a team. Also, I think showing that you're showing eagerness to learn, that's another thing. Ask questions and be really, I guess, encourage you to like really find out what specialty you would like to work in as well during your clinical rotations, because sometimes what you think that you like might not really be what you like. And I think that's actually what happened to me. I thought I wanted to be a pediatric nurse the whole time in school until I did my rotation in the pediatric ICU, and I just really I couldn't handle it. Yeah, it was quite challenging for me too. And that's when I realized, okay, I needed to pivot and I don't think I can be a pediatric nurse. So I think do, different rotations if you have the opportunity to, do, rotate through like specialized clinic or specialties. I encourage you to do that as well. And yeah.
Oh, thank you. How about here in the room?
As far as interviewing process and like thinking about like how you want to present yourself in your interview, just because I've been involved in the interview process for our new hire NPs recently, one of the questions that we sort of like to ask is like thinking of examples of like difficult situations that you've been in and like how you dealt with it. Even if you don't have work experience in nursing yet, drawing on your clinical experiences, and I'm sure you've seen good nurses and bad nurses and who you want to emulate, and situations with patients or situations with physicians that you drew from. I think those are all good to reflect on before going into an interview process. And showing that you have like the attributes that they're looking for. You like you're always looking for people coming into nursing who are really caring about the patient, want to be an advocate for the patient, and like sort of drawing from why you're going into nursing in the first place. Because I think you, even if you don't have the work experience, you want to see that people have the passion of taking care of patients and are willing to work hard.
Thank you, Cindy. How about Iliana?
Yeah, I was thinking the same about having just being ready with those scenarios because you know it's coming. They're gonna ask you something about a challenging, experience, or just have them ready. Practice with your best friend, just say it out loud and feel comfortable with it. I don't have too much new grad experience with interviews, but I did interview for medical school. I went to medical school before finding nursing. which I'm really glad I ended up in nursing. But I always felt that once I was in the interview, you're pretty much like you have one foot in the door. And if you come in with that mentality, like they already like what they see, now it's just me letting, pretty much just taking it home. So coming in with that, like, and seeing yourself already there, asking questions, like Erica said, knowing more about the program and letting them know that you research them and you really know, about them. You want to go there. And then so before Welcome Baby, I worked at Planned Parenthood. I did outpatient with them. So I did interview for them and then the work I'm doing now. And I'm so passionate about it that I really feel that's what they just saw coming out of me. They're like, wow, she really wants to work with this population. She's very, invested in doing nursing here. So I really think that's what got me in.
Great, thank you. And doing segue into that comment for the next question, what populations do you work with and why did you choose to work with these populations? Anyone on Zoom would like to take that one? About the populations that you work with and why?
Yeah, I mean, I work with, I'm an adult gero primary care NP. That's what I did in school. I, like I said, I thought I wanted to be a pediatric nurse, and then I did get a job in the PICU, and I worked there for a couple months, and I couldn't, it was too challenging for me. This is when I was a new grad nurse, actually. And then I, was able to transition into like a med surge adult unit after that. And then kind of further on, like my career, 5 years later, when I was deciding on what to specialize in, and for my nurse practitioner, I did choose just adult gero because I just wanted to kind of focus on adult medicine. Now I work in orthopedics. I see mostly, like the older population. I see a lot of patients with arthritis. I'm in the arthroplasty department, so we do a lot of knee and hip replacements for these patients. And I genuinely really enjoy working with them, and I think it's there's always something to learn from they have more wisdom and from these elderly population, and I do enjoy caring for them, and it's always a really good feeling when they come in with they're very debilitated from either their knee or hip arthritis, and then they have surgery, or and then they come back in and they're able to walk again and to really enjoy life. I think that's something that I really find that's very rewarding in my career.
Thank you, Erica. How about Sarah?
So I actually never thought I was going to go into nursing. My mom was a nurse, but my mom actually got very sick. And so she had cancer, and I was her caregiver. And it was during that time where I realized I actually really want to become a nurse. I didn't think that necessarily I'd go into oncology, but that was my first med surg rotation was on the unit I got hired on later, which was the 4 South at Cedars, which is HEMONC, and I just fell in love with it. It's hard, but it's also such a special thing to walk through with someone through just the intensity of cancer, and it's a very complex illness, and it requires a holistic approach to caring for them, and nurses can make a huge impact with our knowledge and critical thinking in symptom management and just caring for the patients. There's also like my unit specialized in stem cell transplants, which is just so cool. I love it so much. I could talk about it forever. If anyone's interested, hit me up. But I just think that there's something incredibly special about oncology and even helping patients, at the end of life as well, because our unit also was a hospice unit as well. So yeah.
Thank you, Sarah. How about Victoria?
For my population, I work with mostly heart related. So either they just came out of open heart surgery of some sort or like valve or aorta. And also those that are experiencing decompensated heart failure and they need to be in the ICU for specific reasons. Going into it, I didn't really have a say as a new grad. When I interviewed, my first round was with all the managers, and then I guess like whoever wanted you to for their unit level one chose you for the second round, and that was kind of it. But at the same time, I cardiac was definitely one of my top choices of the specialty ICUs. I think more so during my preceptorship, I was at a mixed ICU during nursing school, and there were a couple of heart patients that I was taking care of, and I felt like a really strong like desire to learn more about their care, given that I didn't have that many, but I just felt like taking care of them and learning about the complexities of the heart and what interventions we need to do after their heart surgery was very interesting to me and very engaging. So going into it, like right now, just like what Sarah was saying, I feel like I guess even my unit is very, you need like critical thinking, you need to take care of the patient very holistically, not even just with medications or pharmacologics. There's also like a lot of emotional aspects to it because they're in a lot of pain after surgery or just being in the hospital. They're going through a lot, and they're very at a vulnerable state. So it is up to the nurses to be the ones to really like be initiative and telling them and educating them and just being with them about it and getting through that progress and progression. And also, I felt like I do like the cardiac population also because, at least in the ICU, because there's a lot of them that do recover, are supposed to be recovering, and you get to talk to them more too. So I felt like it was more likely I would be able to connect with my patients there. And it is. I am.
Thank you, Victoria. About here in the room, who would like to take that one? What populations you work with, and why did you choose those populations?
I work in liver transplant, and it's a very specific area. But I think when I was applying for a new grad NP job, this is my first and only NP job that I've been there for almost 10 years now. And I wasn't specifically thinking I want to do liver transplant only, but in doing my clinical rotations, I did see such a variety of the ways that the NPs are working, like I was explaining earlier, as far as the level of autonomy and just the actual role of the job, that I appreciated that this group has a team of NPs. When I started, there were 5 and we went up to 8 because I was hired with 3, and now we have 12 NPs. So I'm at least working with other NPs on a given shift. And sometimes we are working alone on a night shift and you're covering the whole 60-person service, which is daunting and a separate ordeal. But I think going into the job, I liked the group and the way they worked, as well as like that it's a challenging population. It's a challenging role. It was something that I knew if I can master this kind of job, I can get a job anywhere else. And there were some other rotations that I was thinking, oh, if I get a job here, I'll be comfortable. I'll go home at 5 p.m. every day. But if I apply for another job with 2-3 years of experience, I'll feel like it'll be hard for me to hit the ground running in another role that would require more knowledge and more work for me. But I do like the patient population because it's nice to see when people do get better. Unfortunately, we do have very sick patients that they all don't make it to transplant and people die. And I think as an NP, I appreciate being there to be with those families that sometimes our physicians don't have the time and don't have as good communication skills to have certain conversations with patients when they're at end of life. And, you know, this week alone, in one shift, when I was in the ICU, I had like 2 goals of care discussions with patients' families because I figured instead of bothering the fellow that hasn't slept for 48 hours, I'd rather go in and have that conversation with the patients and with the family members. And, you know, we did make 2 different patients DNR in one day because they weren't going to make it to transplant and one was denied for transplant. So it's hard to deal with those situations, but I do think it's also a blessing to feel like you can help a family or patients in those situations. But it's really nice to see when patients do get better and people come back from clinic and they look like a different person and you only recognize them because you recognize their spouse or their child that's always with them. So it's nice to see people turn around and improve.
Oh, that's great.
So
About Ileana.
I I think childbirth is magical.
It is.
I love birth. I love pregnancy. I love babies. So this job, it's just perfect. So I work with mostly Spanish speaking moms, which is nice because they a lot of times don't get, they don't get providers in the hospital that can communicate with them well. I get a lot of African American moms as well, just depends on the area. So we work by best start areas, certain zip codes that you're around California Hospital. And it really pushed me to find out, to just be more trained in what they were experiencing. So as I got training as a birth doula to be able to really just sit there with them and process their birth with them. So I'm sitting there every day hearing about moms birthing, and it's always a whole new story for me. So I really like just being there with them. And personally, I lacked postpartum support myself. So I know how important it is to have someone come in and give you that time, just give you that space to put it all out there and validate that you could be feeling, I love my baby, but it's also driving me crazy. Like, what did I sign up for? So that population those are my people. Like I can, remember what I would have loved for somebody to say to me and just be there with them. So, and it goes from just, personally, like medically, physically assessing them to also, their whole psychosocial surroundings. So it's really just postpartum moms. That's who I work with. That's why I think I always saw myself either in labor and delivery or something with birthing moms.
Great. Thank you for those great responses. For our next question, how did the UCLA School of Nursing prepare you for your current career? Thinking back to your years as a student here, how did our school prepare you for the career you have today? How about Sarah on Zoom?
Sure. I have to say, I didn't put this in my bio, but I did go into nurse education for 3 years while I was at Cedars, which I absolutely loved. And I have to say that even the fact that I graduated with a master's was what allowed me to have all these opportunities. So even though I thought, I might have saved more money if I'd realized I wanted to do nursing earlier and went into a bachelor's program, the truth was me having graduated as a MECN allowed me so many more opportunities. And also our program is very research heavy. A lot of me and my fellow classmates graduated and felt like we didn't get enough clinical time. But I will tell you that as a nurse educator, I worked with a lot of new grad nurses, and pretty much no one feels like they had enough clinical time. It doesn't matter what program they come out of. And it's much more about having that attitude of wanting to grow and learning and being willing to put in that time and having that self-initiative. And having all of that experience with so much research and writing in the MECN program flowed in very well to all of the different opportunities I've had as a nurse, because I was in charge of like Nurses Notes, which was a nursing newsletter at Cedars. I've done research and published, and actually done a lot of writing, which I was surprised by. But there's so many ways that you can apply all the things that come with the MECN program and implement it into your career. And there's so many opportunities in nursing.
Thank you, Sarah. How about Victoria?
For me, I feel like there was a lot of things that UCLA helped to prepare me for my current role, like even just at the basics, the classes, our clinicals. There was definitely information that I utilized from the classes in my career, and especially during the clinicals, like even like the basic nursing skills, I definitely utilize those, especially as a new grad. And even let's say we had to do a QI project for our new grad residency, and we had to create a poster too. And what I learned during my research class, my leadership class, my quality improvement class, we definitely made it easier for us just to create that project. And also, I would say the people that I've met at UCLA, whether it's my peers, my mentors, my professors, all of them, like whether it was just the guidance or tips I got from them, or even like these sessions or organizations that we had. I was one of the cohort reps for my program, so like there was a lot of communication that we had to do with the staff and just knowing more about what goes on behind the scenes and how getting that experience to resolve issues or anything that might come up felt like kind of improved my communication skills and just even talking with the administration, so it kind of built my confidence there. And also just like knowing being a part of some of these organizations like the API or like a PINZA and the Critical Care Nursing Club, I felt like I met a bunch of people through that, and it grew my skills of whether it was service or engagement, or just kind of figured out what I liked to do, even besides nursing.
Great. Thank you, Victoria. How about Erica?
Yeah, I have to say, as a UCLA grad, I was confident that, in my clinical skills, and also the rotations that I had at UCLA as a, nurse practitioner student, really prepared me for my current role. And also just being a UCLA grad, people think that it's a good program, so it has a good reputation. And I I I remember one of the people that I actually interviewed with was actually a UCLA alumni, and I think I got the job because I was a UCLA grad. So I think there's that network. Like if you say you're UCLA grad, people know it's a great school, and that you are very more than well prepared for your first for your for your nursing career. I think in addition, yes, I think it was definitely heavily research based. I remember doing a lot of I remember comp. I don't know if that's still a thing.
Yeah.
Yeah.
Mhm.
Okay. Yeah, I remember spending hours and hours in the library just doing research. And I think that actually at the time, I didn't think that was very relevant because everybody was always like, okay, we need a more clinical hours. But now I think I'm more seasoned in my clinical career, like as a nurse practitioner. I actually find that knowing how to do research and how to analyze the data is so important because you're not going to be able to learn everything in classrooms, right? So there are things that you're going to have to look up down in your career, things that you don't know, and then you need to do your own research to kind of find out what the standard of care is, and you got to use your own judgment and critical thinking skills to kind of analyze the data and the recommendations. So I think in terms of that aspect is very important, and I think UCLA did a great job in teaching nurses how to do research. Yeah.
Great. Thank you. How about here in the room, Ileana?
Sure. So UCLA is my home. I'm glad I ended up at UCLA for nursing. So I had a bachelor's in physiological sciences, and I didn't know there was a Meccan program where you could, go straight to, I remember being in units and having nurses that had been working forever training us, and we didn't know what we were doing. They're like, "You're in a master's program? Like, how does that work?" That was very strange. I remember that. So the same class with Sarah. But I thank UCLA for introducing me to public health nursing, something that, I hadn't really been exposed to. You have a certain image of what a nurse is, and that's kind of what you think that's all there is. So public health nursing, I thank them for that. And during our Meccan program, there was a trip to Uganda. I was able to go to Africa and see what childbirth is like over there. So that was mind blowing. That just gave me a whole perspective, but it also, I kind of wanted to see a little more of that here. I just know that that's just a different model, more of a midwifery model, which I considered, but I think I'm done with school. But yeah, just kind of getting to see childbirth in from another perspective. And speaking of comp exams, research writing is not my thing. I remember that thing was brutal, but looking back, I wrote about the job I'm doing now, which is crazy. I wrote about social support, supporting moms and improving their pregnancy and lowering low birth weight for babies. And I'm just like, wow, crazy how that made a full circle.
Oh, thank you. Cindy.
I think that the classes at UCLA provided a good foundation as far as like the pathophys classes, and for the NP school, I don't even remember all the numbers, but all various classes. But I don't write as much as I did during school, but it provided me with the tools that I know how to look up things when I don't know, if I don't understand a disease process, if I want to look up research articles. Things are ever changing in medicine. I graduated the Meccan program in 2010, and when I worked at Cedars, we were like doing the trials for the TAVRs, and now they're in full use. Victoria, I sound like an ancient person when I say that they were doing trials at Cedars for TAVR, and now they're all over, even in smaller community hospitals. But things are ever changing. So knowing how to do research, knowing how to look things up, and you're going to be going into very specialized areas that you won't even imagine, like being in different workplaces once you get a job. And knowing how to look things up and do research and staying on top of your practice is going to be important, because you don't want to fall into this complacent role of, I'm just clocking in, clocking out, I'm doing my meds, I'm taking care of my patient. No, you need to really understand what your patients are going through and what the doctors are ordering, because it is your responsibility as a nurse to help the patients understand what they're going through. And, sometimes I would do like little teaching sessions with patients about their medications, and they're like, "Oh, wow, I'm given all these pills. I had no idea what I was taking." And people do appreciate when you take the time out of your day to explain things to them, and you wouldn't be able to if you didn't really have that understanding. So I think just having those tools and that foundation is important.
Great. Great answers all around. For our next question, how would you describe your work-life balance as a nurse? How do you keep yourself? What self-care practices you employ? How do you juggle the everyday busy lives of a nurse? About Erica.
I I work, I think my work-life balance is pretty good. I work office hours, so Monday through Friday, like 8:30 to 5. I don't work weekends, or I don't work holidays, and I'm never on calls. I think it's a pretty good gig for nurse practitioner. In addition, I work out, I exercise. I live in the Bay Area, so there's a lot of good trails all around me, or very outdoor, lots of outdoorsy things to do. So I think exercise is probably my main outlet to for me to relax. And also, you know, having good social support around is also good. You know, my family and friends who I turn to when I'm stressed out. And also having like, I have great work colleagues who are, you know, always willing to help out and um, just just having a supportive environment overall. I have to say I'm pretty lucky to have all of that here.
Hey, thank you, Erica. How about Victoria?
For me, I work 3/12s as a bedside RN. So when I think about it, like 3 days a week, I have like 4 days off. I feel like, what am I doing with my time? But there are times where I feel like I am working a lot if it's in a row, depending on how the schedule plays out. But like if I just have other stuff to do, and it's nice how where I work, I can kind of self-schedule for the most part, and I get most of the days that I ask for, but we do have to work every other weekend. Um, but in my spare time, I would say I do like to go be outdoors, just kind of like Erica. I do like to go on hikes. I am also in the Bay Area, so I love going to Golden Gate Park near where I live, or Muir Woods or Mount Tam, where there's more trails. And I agree, having a good social support, especially for those hard days. I turn to my significant other, my friends, and even trusted coworkers that I have that turned friends to talk about the day. So that really helps me just sometimes, like, knowing that I can put work aside, especially at the end of the shift. Like, of course, you know, we're still always learning, so I kind of reflect back on what I could do better. But also at the end of the day, like, kind of try to tune it out when I'm on my off days, just so that I don't get burnt out in the long run more so.
Thank you. Well, Sarah.
I am incredibly lucky. I actually work 4 days at home and I work 1 day on site. So I do mostly remote work. I'm very, very, very thankful for that. I have to say that when I was on the floor, I would always tell new grads as a nurse educator that if you are going to be working on the floor, you should be doing some sort of strength training. And you should be having an exercise regime. It's just kind of like standard for being on the floor and having to do that physical work. I did injure my back at one point, and most of my coworkers had at some point. So you do want to do that to protect yourself. And then, as everybody's been talking, such an important part of just taking care of yourself emotionally as well, and having that social support system. I remember whenever I would have a patient die, I would just message a few people to just let them, I just needed to let you know that I lost a patient and they were very special. That's kind of like all I would say, but just that act of saying it to somebody and then, you know, talking about it with my coworkers and us going through it together was always really powerful.
Thank you, Sarah. Back here in the room. Work-life balance as a nurse. How about Cindy?
I don't always feel like I have the best work-life balance. I think after becoming a mother, it's harder. I only have one child and he's 4, and now that he's in school, it's a little easier. But you know, until he turned 3, when I was home all day with him when I'm not at work, was hard. But you know, I feel like you deal with it. Whatever stage of your life you're in, you make things work. I do think it's important to have those colleagues that are there for you to vent when you have a rough day. It's not going to be easy. Nursing is not a career for the faint of heart. There are days that I remember driving home from work in tears because it was just a stressful day. It was overwhelming. I didn't feel like I could relax on my break time. I was dealing with someone in pain that didn't have enough pain meds on board, or, you know, you have doctors that you think are upset at you because you couldn't get all the I's and O's in, or, you know, various things that I do recall several shifts that, you know, that feel like you might not be able to continue in this career. And having friends from your nursing program or from your new grad program or that you work with to vent to is good, because sometimes your spouses and significant others just can't fathom what you experience at work. So having a group of friends that you can vent to is very important. I can't say that I exercise regularly, but sometimes just going out for a little jog just helps you release that extra stress. And I do think exercise does help. I try and go to the gym here at Wooden at 6 a.m. before I start my 7 a.m. shift. And I do think on the days that I get workouts in, even if it's tiring, I feel more energized for the day when I do get like a short workout in. But yeah, work-life balance is important, but yeah, some people think that you have 4 days off. You must have enough time to do all the things. And it's like, no, not really. I'm just in a vegetative state sometimes after a night shift that your body needs to recover, your brain needs to recover, and trying to take out that time for yourself is important. But I am in this like sandwich generation right now that I'm taking care of a child and elderly parents. And I was just telling Ileana, my dad had surgery, and I was like a home health nurse visiting him, giving him a little sponge bath and taking care of his Foley at home, and trying to appease, like, reassure my mom that he'll be okay. But it's hard. I do think it's hard, but there will be days that are going to be very challenging for all of you, and just know that you'll get through it, and having people there to support you is really important.
Thank you, Cindy.
That's
Ileana.
I get to make my own schedule, so that's great. I don't work holidays, weekends either. And with scheduling my visits, so I do have to meet a certain amount of visits during the month, but I can schedule it around, going to my son's school events or his award ceremonies. He'll be 8 on Saturday.
Oh,
And so that means a lot to me. I really want to be there for him. And after very tough visits, very traumatic birth stories, or I've had a lot of just immigration journeys that they just come out and share it all with you. And I'm like, what do I do with this? Every week I meet with my supervisor, and it's pretty much just therapy in a way, where she just wants to know how I'm doing, what I need from her to be able to keep doing this job, because burnout is real. And then a couple times a month, we actually meet as a team, and we all just kind of, it's like literally like a little kumbaya circle. People think it's like weird, but that's what we're doing. We're just really supporting each other and talking about what's going on within our team. And then personally, the gym, if I don't go to the gym, I am not okay. So I schedule something around there. I gotta lift something heavy every day. And I'm a big sports girl. So you'll see me at a Dodger game, you'll see me at a Rams game. I have to get that in as well. And my 8-year-old just keeps me making sure my energy is up there to keep up with him. So yeah.
thank you. And we are nearing the hour. So for our last question, I'll give you a couple of seconds to think about this one. What does it mean for you to be a Bruin nurse? Think about your years back here as a student, your experiences, the friends you made, your professors, and all the great experiences that you had here at the UCLA School of Nursing. And what does that mean to you? How about Sarah?
Big one. For me, I would say that it's just means working with excellence. I think UCLA has a very high standard, and I'm very proud of that. And I want to be giving that back to my patients and my colleagues. And I'll just leave it at that, since we're very short on time.
Thank you, Sarah. How about Victoria?
To me, to be a Bruin nurse means to lead care with, I would say, compassion, empathy, and integrity. And that also includes supporting and empowering each other along with our patients, not just them, but our community and our coworkers and everybody around us, especially in this healthcare environment that's ever changing, and also just striving for continuous growth, say.
Yeah, Victoria. Erica.
Yeah, I think I just say with a lot of pride that I'm a UCLA alumni. Like I said, we have a great reputation. And when I tell people that I'm a UCLA grad here, people are always like, wow, like, they always assume I went to UCSF because I worked there. But I'm like, no, I went to UCLA, the better school. People are always like, oh, wow. And then, there's nothing but praise. when I tell people that.
Oh, that's good.
So, I have a lot of pride when I tell people that. Yeah.
Good. Hey, thank you. About in the room, Cindy.
I hard to come up with something unique after those answers, but yeah, I do think being proud of our UCLA School of Nursing, and I do think there is a level of excellence that is sort of expected from our graduates, and there's also community, and just to add on to other people, just having my dad in the hospital at Santa Monica UCLA, I was surprised to see how many old classmates, old colleagues between various units at Cedars and at UCLA. And I've seen lots of nurses come through our unit at UCLA in 8 North and 8 ICU. You get a community of nurses, and people are everywhere, and everyone helps out each other. And it's really nice to see that everyone really cares about your family.
Yeah.
Just to add on to the other things, it's also about like the community.
Thank you, Cindy. And Ileana.
So I'm right there with you, Erica. It's a lot of pride. It's your brewing pride. I mean, when I say it, you can tell that they're like, whoa, she's really, proud of where, of where just being able to say UCLA. And I'll never forget, for undergrad, my dad still has like a cutout of some sort of article of just how hard it was to get into UCLA. So that's something that I think we should all really remember. Like, I know when we're here and they're grinding us and it's really hard, and you really forget everything that we did to get here, and how just, we did that. We were able to get here and do that. So yeah, to be able to go out and reflect that in our work, I think that says a lot.
Great. Thank you so much, everybody, for spending this last hour with us. Give it up one more time for Victoria, Sarah, Erica, Cindy, and Ileana. Thank you. And please join us back in the fall when the Alumni Panel program returns. Thank you so much, everybody. Have a great rest of your day. Bye.
Thank you. Bye.
Thank you.